Okay. Now we want our Dr. Mutmainah Sani, to take us through this journey, and Alhamdulillah, she's here now with us. So before she commence her speech with us, I would just like to take a recap. I know we've all seen the flyer, meet our speaker rather. So let me just read a brief profile of Dr. Mutmainah Sani. Okay, okay. Let me hand over to Sister Balkis Olawumi. Is she even around? Sister Balkis, if you are here, please signify, ma. Sister Balkis Badamosi, are you around?
Now I'm around.
Okay, so I've actually opened the floor, so you can please quickly help us to read the brief profile of our speaker. Jazakumullah khairan, ma.
I mean,
Yeah.
Assalamu alaikum, everyone.
Wa alaikum assalam wa rahmatullah.
A minute, please. Now, let's meet our speaker. Our speaker for today is Dr. Sanni Mutmainah. Dr. Sanni Mutmainah is a proud Muslimah with a passion for women's health, who has been blessed with a solid track record of academic excellence. She entered university as the top scorer on the entrance examination post-UTME and finished at the top of medical school class at Obafemi Awolowo University in 2019, winning numerous awards. After completing her internship at Obafemi Awolowo University Teaching Hospital, she worked at Etiosa Maternal and Child Care, a general hospital in Lagos, where she worked in the pediatrics and obstetrics unit. Eager to combine clinicals and academic research work, she recently earned her MSc in clinical embryology from the University of Oxford. She also volunteered with the Bashir Foundation for Fistula and Women's Health, developing accessible and relatable women's health content. As she progressed in her medical journey, her goal is to bridge clinical care and scientific research to advance women's health care, and she looks forward to doing impactful work and creating spaces that focus on improving women's health and well-being. Mashallah, Dr. Mutmainah, we are happy to have you. We are honored to have you on our program today in Sparkle Connect. Sister Mutmainah, are you here with us?
Um, Hi, assalamu alaikum.
Wa alaikum assalam wa rahmatullah.
Okay, should I
Sister
read it?
Dr. Mutmainah, are you here with us?
Yes, I am. Can you hear me?
Nah. Assalamu alaikum.
Wa
The
alaikum
floor
salam
is
wa
open for
rahmatullahi
you.
wa barakatuh. Okay. I don't know, would it be possible for me to project my screen? Um,
Sister Amina,
Yes, ma. Yes, you can share your screen.
okay, one moment, please. Okay, can you see my screen?
Now,
Okay.
Yes.
All right. أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم. So, Assalamu alaikum wa rahmatullahi wa barakatuh, everybody.
walaikum
Um,
salam wa rahmatullahi wa barakatuh.
it's my absolute pleasure to be here today. And thank you all for taking time out of what I'm sure are your busy schedules to listen to me this evening. And inshallah, today we'll be talking about the silent killers. I know it might sound very scary, like, oh my God, what is killing us? And my aim for this talk is not to scare you or to make you afraid and all of that. The overall aim, inshallah, is to empower us and enable us to be able to take charge of our health and be able to take practical daily steps that would contribute in the long run to improving our health and well-being generally. And so let's dive into silent killers. The scary name just means that the reason why I term them silent killers that most of the diseases that we're talking about today are usually very sneaky. They come in um they come in, do not show symptoms at all, or if they show anything, it might not really look like a symptom. So people don't even know they've come down with that disease. And usually by the time they present, it's usually when it's advanced and sometimes harder or even impossible to treat at that point. That's why I call them the silent killers. As they are there and they continue to wreak havoc. So today, inshallah, we'll be talking about, I chose 4 diseases to cover, and that would be hypertension, diabetes, breast cancer, and cervical cancer. And again, to reiterate, the focus of this talk is not to scare you or to leave you, scared. Basically, it's more of empowerment and focusing on practical, actionable steps that we can take. When it comes to your health, knowledge really is power. So let's get into it. So we're starting with hypertension, also known as high blood pressure. I'm sure most of us here would have had high blood pressure, if not all of us. And might be wondering, what exactly is high blood pressure? I just know that they say, well, yeah, the person is thinking too much, right? They have high blood pressure. So high blood pressure, everybody has a blood pressure. If you don't have a blood pressure, you will not be alive. And blood pressure refers to, the force. So we all have blood flowing through us, and this blood goes through some tubes known as blood vessels. So the force that the blood that is flowing is exerting on those tubes is what is called the blood pressure. And when this pressure is persistently elevated, it is not very good. And that is when it's called high blood pressure or hypertension. And this could lead to so many complications because you have blood flowing through all of your body. So if it's coming at a very high pressure, it is affecting every part of your body from your head down to your feet and everything inside. That is why high blood pressure is a very, not scary disease, but a very hard disease to manage sometimes. And another thing that happens with high blood pressure, in keeping with the theme of silent killers, is that it doesn't usually show any symptoms until it has caused complication. So after it has caused damage to some of the organs that it's supplying, it is that damage that will present as complications. The actual high blood pressure doesn't really show any symptoms. So if at all it's going to show any symptoms, it might come with headache, blurry vision, dizziness. Well, this is usually if it is very high or if it has been around for a long time. For most people and for the most part, hypertension is usually very silent but deadly. And these are some of the complications. So now to the focus, which is, like I said, I'm going to be focusing more on prevention and what the steps we can take to not to save ourselves or to manage hypertension. And one thing is, because the high blood pressure doesn't show any symptoms, it's important that you check the blood pressure values yourself. So I'd recommend at the very least do it twice a year. So every 6 months, have your blood pressure checked. And it's very easy these days. You can walk into almost any pharmacist or chemist and they would have the machine for checking the blood pressure. So have your blood pressure checked, record it. And if they tell you that it is high, go see a doctor ASAP. So that is one way you can take your health into your own hands. Don't wait for symptoms to show. Don't wait to be sick before you do anything. Have the blood pressure checked so that you know where you stand with your blood pressure. And before, high blood pressure, hypertension used to be thought of as a disease of old people. But now more and more young people are coming down with high blood pressure. That is why we should start now. Start checking your blood pressure now. At the very least, do it twice a year. Twice a year is not much. Walk into any store, ask them that, oh, I want to check my blood pressure, and do it and take actions as appropriate. So apart from checking the blood pressure regularly, another thing you can do is controlling the risk factors. There are certain things that could put one at risk of developing hypertension. And most of these things are centered around your lifestyle. So things like if you're overweight, if your weight is higher than it should be, focus on reducing the weight. If you do not get exercise in, exercise. And exercise doesn't have to be major. It is recommended that you do 30 minutes, 5 days a week. Now I'm not asking you, oh, I have to go and join a gym. I have to start doing all of this. It can be things that you can easily incorporate into your day. 30 minutes is broken down into 10 minutes 3 times. And it could just be going for a walk with your kids, or skipping, playing with your kids. Or if you're one thing, another thing that can easily be done is don't be the type of person that just takes the bus or drives everywhere. Walk. You're going to the market that is down the road to get something. You don't have to drive there. Walk. Those are ways of getting little ways of getting exercise into your day. And because it is little and it's not a major change, it's easier to sustain long term. Also, I'm sure this doesn't apply to anybody else. I'm hoping it doesn't apply to anybody else. Reduce your alcohol, avoid alcohol, reduce or no, not even reduce, avoid smoking, reduce alcohol. But I'm sure that doesn't apply to anybody here. So the important things I would want to reiterate before we leave hypertension is the diet. Reduce salt intake in your diet. Also reduce fats in your diet. If your weight is more than it should be, control your weight. And lastly, even if you're thin, doesn't mean you're excused from exercising. Everybody should get in 30 minutes of exercise at least 5 times a week. And these are some of the risk factors. And the thing with hypertension is that after a diagnosis of hypertension, it doesn't mean it's the end of the world. It can still be, it is manageable. Just ensure that whatever treatment plan you are placed on by your doctor, you adhere to that treatment plan. So if you are giving drugs, use the drugs how you are told to use it, when you should use it. Hypertension is not the kind of disease that you use the drug when you feel like, oh, I've been having headaches a lot. I think my blood pressure is high. Let me use the drug they gave me. No, even if your blood pressure is fine, yeah, you check yourself. Continue using your drugs the way you are told to. There's a need to change your drugs. Your doctor would change that for you. So the next disease we'll be talking about now is diabetes. So diabetes is high blood sugar. And also because it's something to do with the blood. In the blood, it can affect any organ because blood goes everywhere. So anything can be any organ in the body, your brain, your kidneys, your heart, anything can be affected by diabetes, also known as high blood sugar. So what happens in diabetes? Like the name says, high blood sugar. When the blood sugar is high, but why would your blood sugar be high? So anything you eat is broken down eventually into glucose, which is a form of sugar. And then it is this sugar, the glucose, that your cells would turn to energy that they would use to do everything. So everything that your body can do, it requires energy to do it. So are you growing? Are you talking like I'm talking right now? Every single thing that you are doing that your body does, it requires energy to do it. And it gets this energy from the glucose or sugar that is gotten from your food. But there's another chemical in the mix known as insulin. And this insulin is a messenger between the sugar in the blood and the cells. So it tells the cells that, oh, there's sugar in the blood, take it up and use it to make energy to do what you want to do. So what happens in diabetes is that this messenger, this insulin, is what is at fault. So it is either that it is not available in enough quantities, or it's not even available at all, or it is available in enough quantities, but for some reason, the cells they cannot listen, they cannot see the insulin. So it cannot tell them that there's sugar in the blood. So there's sugar in the blood, but the cells cannot take it up because they cannot hear insulin that, oh, take up the sugar. And this means that one, energy will be low. Your body can't function the way it should function because it cannot use the sugar in the form it's supposed to use it. And because the sugar remains in the blood, sugar is not supposed to be high in the blood. It can also cause damage everywhere. And that's why diabetes is a very scary disease. And also, like hypertension, it also doesn't usually show symptoms until it is quite advanced. If I thought it's going to show symptoms, some of the symptoms might be excessive thirst. So you find yourself thirstier than usual, and then drinking a lot of water. And then the next thing is you begin to urinate a lot. Then tiredness, because like I said, your cells are not taking up the sugar. They're not making energy. They cannot do what they're supposed to do. So there's tiredness. And then some people, they might have like weight loss and things like that. And the risk factors for diabetes are quite similar to those for hypertension also. So that means that the way for you to prevent it, or the way for you to work at preventing diabetes, is addressing these risk factors. So addressing your lifestyle factors, your diets, avoid excessive fat in your diet, avoid excessive processed sugar, carbonated drinks with lots of sugar, then control your weight. If your weight is higher than normal, take measures to reduce your weight, and then incorporate exercise into your routine. Whether you are fat or you're slim, you should be exercising 30 minutes 5 times a week. Get your heart pumping. And then same thing with alcohol and smoking. And if a diagnosis of diabetes has been made, it's not the end of the world. It can also be managed. So just ensure that if it's that you're going to be placed, if it's that the person is going to be placed on replacement insulin or giving some drugs to help improve that communication between the cells and the insulin, whatever treatment plan one is placed on, ensure that you adhere to that treatment plan. If you have any concerns or like you're worried about any of the drugs you're taking, don't stop it on your own. Discuss it with your medical practitioner that, okay, I don't want to take the drug again. Is there an alternative? So ensure that, because if it is not managed, it would wreak havoc everywhere. And also a silent killer, the theme of this talk. Then the third one I'm talking about is breast cancer. Before, in the past, or at least growing up, I've always thought of breast cancer as, oh, it's something that old people have, like, oh, it's old people that come down with breast cancer. Well, unfortunately, it's not the case anymore. More and more young women are also being diagnosed with breast cancer. There was something I even heard yesterday that I was like, oh, wow. Do you know that last year, breast cancer was the most common cancer that was diagnosed in Nigeria among all adults, both male and female? The commonest cancer that was diagnosed last year was breast cancer. That's how common breast cancer is. And the thing with breast cancer also is by the time it shows overt symptoms or very clear symptoms, it usually is already advanced. So when the person is already having very obvious skin changes or a very huge swelling in the breast or excessive pain and things like that, it almost is always very advanced by that time, which is why early detection and regular screening are key to beating breast cancer. For you to be able to detect breast cancer early, you have to be screening, because if you're not looking for something, you will not find it. So you have to be screening for breast cancer regularly in order to be able to detect it early. And some people might say for breast cancer, I thought it's just like if it's not running in our family, nobody in my family has ever had breast cancer. Even people without a hereditary factor, they are not immune. Like, it doesn't protect you from not having breast cancer. So everybody, whether you have a family, whether there's a family history or not, should be screening regularly for breast cancer. So I've been saying screening. How do I screen for breast cancer? So the first thing I would talk about is the self breast exam, which is literally, it is you taking your health into your hands, basically. So like the name says, self breast exam, examine your breast by yourself. And it is recommended that this is done monthly. And how is this done? Briefly, if you're like me that forgets stuff, I would say have a reminder on your phone. Set a monthly reminder. Oh, do a self breast exam. And the best time to do it is usually just after your period. So after your menses, you can do after you do your ghusl bath after your period. Just take 10 minutes to do your self breast exam. How do you do it? It involves two things. You're looking and you're feeling your breast. So the first thing, stand in front of a mirror, place your two hands on your head like this, and then look at your breast. Look at it from the front, look at it from the side. What are you looking for? You're looking to see whether there are any obvious changes. Is there any change in size? Is there any change in shape? Is there any distortion of the skin? Is there anything abnormal on the breast? So after you look at the breast, the next thing is to feel the breast. So you're going to do it one after the other, and you're using the opposite hand. So let's start with, if you're starting with the left breast, you will use your right hand to feel the left breast. Then you place your left hand either on your head, like you did before, or on your hip. This helps make the breast prominent. So when you do that, you take the hand you want to use to examine the breast. And a good tip I'll say is divide the breast into 4 quarters so that you don't miss anywhere. So you can divide, let's say that would be like upper right, upper left, lower left, and then the nipple area. So just start from one of the quarters. So maybe go from outside inwards. So start from, let's say, the lower right, feel that. Move on to the upper right, feel that area. Move to the upper left, feel that area. Move to the lower left, feel that area. Then lastly, feel the area of the nipple and the skin surrounding the nipple. Then to end it, just press the nipple and see if any discharge comes out. Easy peasy. Do the same thing for the other breast. And then you do that standing and lying down. What are you feeling for? you're feeling for any abnormalities. So you're feeling for lumps, you're feeling for any tightening in the skin, anything that wasn't there before, which is why it is emphasized that it is done regularly. If you're not doing it regularly, you don't know what your breast looks like. So you might not know what is abnormal. So however, if you're doing it regularly, you would know that, oh, this was not what I felt last month. It's like as if something is different in the breast. So you have to be doing this every month. So 10 minutes every month could potentially save your life. So that's a very good thing to do when it comes to breast cancer. So what happens if anything abnormal is detected? I'll come back to that. The other way for screening regularly involves you going to the hospital. And there are two things. If you're 30, if you're less than 40, it's recommended that you do what's called a breast ultrasound every 1 to 3 years. So it's like ultrasound that you do like when you're pregnant, just to look inside, because all the feeling and looking, you can't see inside the breast itself. So that's what these two tests, the ultrasound and the mammogram, are to do. The mammogram is kind of like a mini x-ray. So just to look into the breast tissue to see if there's any abnormal tissue there. And because these tests are being done regularly, they'll be able to detect if there's going to be cancer, they're going to detect it very early. And at that point, if it's very early, it is potentially curable, as against when it's advanced and very hard to treat. So that is the importance of regular screening, so that you can detect it early. If it's detected early, it can be treated, can even be potentially cured at that point in time. So what happens if you discover anything abnormal? Let's say, for example, during one of your self-breast exams, you felt a lump. What next? Next thing is continue to take charge of your health by presenting to a doctor as soon as possible. It is recommended that that's done within 2 weeks of finding something abnormal. So present to the doctor, and then do not let anybody give you any false reassurance or anything. Ensure that the doctor examines you. Okay, doctor, I felt something abnormal in my breast. Like, I know you're young, it's probably nothing. Don't take that. Tell the, like, I would like you to examine me. And after the doctor examines, I'm like, oh yes, I can also feel a lump. I would like to have a test done. So then they would often recommend you do one of these tests, either the ultrasound or the mammogram, just to look into the breast. And if they see something abnormal, don't let them still fob you up and say, it's probably normal, I'll be going. Tell them that, no, I want you to do what's called a needle test. Take a bit of the tissue that is there and send it to the lab. Let them see if it has cancer or not. And then, so this, when it comes to your health, you are your biggest advocate. Speak up and insist that you want to find out what is wrong with you and what is going on. And if at any point you're unclear, ask for clarifications. It's your body, it's your life. So, and that's that for breast cancer. So early detection, regular screening first, now to detect early. If anything is detected, take charge of your health and ensure that it is managed accordingly. Ensure that you have a test done to find out what exactly is going on. Because truly, 1 in 10 lumps, like if for 10 people that feel a lump, only one of them will have cancer. But because the consequences of having breast cancer and it not being treated, it being missed, is very hard, as everybody has to have a test if something abnormal is felt. And with this, we can beat breast cancer if everybody's focusing on regular screening and early detection. And last but definitely not the least, is cervical cancer. And this probably has the scariest statistic, like one woman literally dies from cervical cancer every 2 minutes. That is, every 2 minutes that passes, one woman has died from cervical cancer. That is very, very scary. And also, like the other diseases we've talked about today, the silent killers, it also usually has 0 symptoms in the early stages. And it might have some symptoms, but by that time it's really advanced. However, if anything abnormal is noted, if you are noticing abnormal bleeding between your periods, abnormal discharge, very smelly discharge, or bleeding after intercourse, go and see a doctor ASAP. Have it checked out. So, but because, like I said earlier, I'm going to focus on prevention. So, how do we prevent cervical cancer? How do you detect it early? Before it gets to very advanced cancer? Let's take it back a bit. What causes cervical cancer? So, there's a virus known as HPV, human papilloma virus. So this virus it causes like 99% of cervical cancers, and it's a virus that is gotten from sexual contacts, and it stays in this. Sorry, let me dial it back a little bit. Well, I've been saying cervix and cervical. The cervix is just the neck of the womb. So the womb, then just the cervix is like the neck, the entrance to the womb that goes into the vagina. So that area is known as the cervix, and that's where cervical cancer occurs. And so this HPV virus, it goes into the cells in the cervix and turns the cells that were previously healthy, it turns them to abnormal cells that will now eventually become cancer if these cells are not removed. That's HPV. So in order to prevent cervical cancer, we have to prevent the HPV infection in the first place. So for those of us with young girls with daughters, or those of us that have not been sexually active yet, it's best to get what's known as the HPV vaccine, which is a vaccine is to prevent infection by that disease. So it's a vaccine to prevent infection with HPV. And down the line, it prevents the person will never have the infection, not talk about having cervical cancer. Then for those that have already been sexually active, what's recommended is known as a pap smear, which is a screening test. So what happens in a pap smear is that um, a a brush is to take just a few cells of the cervix, looked at under a microscope to see one, have they been infected with this HPV, and two, are the cells still looking healthy and normal? And the frequency that is recommended for this pap smear test is from the age of 21 up to 21 to 29. No, I think 21 to 49. I'll confirm and get back. I think 21 to 49, the test is done every 3 years. Then from 50 and above, the test is done every 5 years. So that's regular screening so that it's picked up early when it is easily treated. If abnormal cells are seen at the pap smear, the cells are simply cut out and that's the end. Like there's no talk of cancer coming down the line. However, if one is not doing screening, there's no way that these cells would have been picked up in the first place. So also with cervical cancer, regular screening and prevention are key to beating this very scary cancer. And that's the last of the diseases. So I hope that I have not left you scared. I've talked about cancer, I've talked about hypertension and diabetes, but that was not the aim of this talk. The aim of this talk was to give us practical, actionable steps that we can do to take charge of our health, lifestyle factors, or screening tests. And I would like to encourage each and every one of us here, like from today onwards, we're starting a new week tomorrow. Write down what are you committing to do for your health. Like, is it that, oh, okay, I'm going to go and have my blood pressure checked tomorrow, and then I'll check it again in 6 months' time? Am I going to go and have my blood sugar checked at the hospital, and then I'll have it checked again in 6 months' time? Am I going to start exercising? Would I get an exercise body? Oh, 30 minutes, 5 days a week. I'll go for a walk. Or is it that I'm going to do a self breast exam today and then continue to do that every month? So let's take charge of our health and let's be committed. Like they say, prevention is better than I can't remember what you saying. But when it comes to your health, basically knowledge and awareness are key. And more important than that, it's not just enough to know and be aware of diseases. It's also important to be taking steps every single day to prevent these diseases coming down in the long run. Thank you very much, and I hope that was very helpful.
Now, Jazakumullah khairan, Dr. Mutmainah. May Allah reward you abundantly. Sisters, please, if you have question, kindly raise up your hand. Sisters,
Keep quiet too.
now, Sister Okpayemi, I can see Sister Okpayemi. Kindly unmute yourself and ask your question. Sister Okpayemi.
I'm raising my hand though, but I'm not Okpeyemi. I'm Medina.
Now, kindly ask your question.
Assalamualaikum, ma.
Walaikum salam.
Jazakumullah khairan. It was really an insightful speech and presentation. But I would like to know, ma, like what are the things that are associated to high blood pressure? Like what if one is not stressing, one is not thinking, but the blood pressure is still high? What could be the possible cause?
Now, Dr. Mutmainah, should we take the questions once or you will answer one by one, ma?
Okay, let's take everything and then I'll just so that I'll not be unmuting and muting. Let's take all the questions now and then I'll
All
respond to
right.
each of them.
Now, Sister Aisha, please unmute yourself.
Okay. Hi, Assalamualaikum. Jazakumullah
Okay.
khairan, ma.
Now,
An insightful question. I learned a lot. I have two questions real quick. So one for the so there was a time I saw a doctor. Yeah, I saw a doctor and then I just went for general examination, and so I just told her I want to examine, so I want to do a a test just to be sure that everything is fine. So she said I should do a pap smear test. But I told her because of what I've read, the discomfort and all of those things. I told her I'm not sexually active, so why do I have to do this test? And then she was insisting that, oh, you get more accurate results with that and all of those things. Then I brought the idea of HPV, and she said, well, she can't really say, you might not get an accurate result and all of those things. I want to ask, what do you have to say about that? Then, for the breast examination, I learned mammography is for people 50 years upward. I don't know how true that is. Can we do like a scan, a breast scan examination, or there's something else just to be sure that everything is okay? Thank you.
Sister Aisha, is that all? Sister
Yes, please.
Aisha.
Yes, please. Thank you.
Now, kindly unmute yourself.
Assalamu alaikum warahmatullah.
Wa alaikum salam wa rahmatullah.
Now, Jazakumullah khairan to our lecturer. I have few questions here, and the first one is about breast examination. She mentioned that we should do it during our menstrual cycle. So I want to ask for pregnant women, how do we go about it? Should we continue with it like every day or once in a month? Then the second question is about cervical cancer. So she mentioned something about sexual intercourse. So I don't really get that part very well. I want to know, is the cervical cancer, is it transmittable like between a man and a woman? And then the third question is can I recall? Okay. The third question is about exercise. Why she was talking about these diseases like the diabetes, the high blood pressure, and all. She was constantly mentioning exercise. How can you, I mean, is this exercise, is this something that if we don't do it, like it can actually result to something it can actually result to something as regards to our health. Because when you mentioned one of the diseases, you mentioned exercise, you mentioned another one that you mentioned exercise. Jazakumullah khair.
Amin. Now, kindly unmute yourself. Sister Abisola. Sister Abisola, kindly unmute yourself and ask your question. Sister Abisola, kindly unmute yourself. Dr. Mutmainah.
Yes, yes.
Now, I think we should start answering the question, ma.
Okay, okay, okay.
Now, Jazakumullah khairan.
Okay. So the first question was, what are the things associated with high blood pressure? Like the person is not thinking, like, why is the person still having high blood pressure? So the thing with high blood pressure, I don't know if you remember from when I was talking about it, I talked about the risk factors. These are things that put you at risk of coming down with high blood pressure. And one of a major thing with high blood pressure is your lifestyle factors. So what are the kind of things you are eating? What does your diet look like? Are you having lots of fats in your diet? And also your salt intake. Apart from that, also still on lifestyle factors is exercise. Are you getting enough exercise? Are you getting your heart pumping basically 30 minutes, 5 days a week for 150 minutes? And the thing with thinking and all of and high blood pressure, it's so instead of thinking, I'm going to be using stress now. So with stress, if it's acute, that is, if it is just like one time stress, let's say you've been in traffic all day or something happens, that acute, that short-lived stress can cause a very high increase in the blood pressure, but it comes down. However, if the stress is over a long period of time, there's constant stress. And stress can be, it's not just thinking. Your job can be a source of stress, study, are you getting enough sleep? So if that stress is over a long period of time, it can cause high blood pressure. But just one-off stressful events do not necessarily cause high blood pressure, because high blood pressure is persistent, consistent elevation in the blood pressure. So even if the person is not thinking, there are other things that could put the person at risk of coming down with hypertension. And in addition, there's also a family history. Family history is another thing. Like if there's a history of hypertension in the family, say the dad, the mom, the grandparent, the uncle, that also increases one's risk of having high blood pressure. Then, apart from that, also, in some people, the exact cause of the high blood pressure is just not known. So even if a person does not have any of the risk factors, they might still come down with high blood pressure, which is why you have to be checking your blood pressure. It's not enough to say, oh, I don't have risk factors. You still have to keep checking your blood pressure. However, if you're taking care of your lifestyle factors, it plays a significant role in reducing your chance of coming down with high blood pressure. I hope that was clear. Then the second question was about if the person is not sexually active, is there still a need to do a pap smear? So the person is not sexually active or if the person has not been sexually active, the person can choose not to have a pap smear until they become sexually active, even if they are above the age of 21, because the major thing that is being checked during the pap smear is HPV infection in the cells of the cervix. So, and the only way you can get HPV is through sexual contact. So ideally, there's no way for them to have acquired HPV. So they can opt not to have a pap smear until they become sexually active. So that's for someone that has not ever been sexually active. However, if you've been sexually active before, you've just not been sexually active for a while, you still have to get the pap smear because the person could have gotten it from the past sexual encounters. And so in that case, for that kind of person, they can just go for someone that has never been sexually active, they can just go for the HPV vaccine as against a pap smear. Then the next question was something about mammography, that the age. So usually the mammography is done from age 40 and upwards. So for someone between the ages of 30 and 40, they can have a breast ultrasound. But ultrasound is a scan basically, so they can have a breast scan from age 30 to 40. Then less than 30, they can just still be doing just the monthly self-breast examination, and then from age 30, begin to have the breast ultrasound, and then 40 upwards, mammography. And for the mammography and breast ultrasound, the frequency required is between every 1 to 3 years to have this imaging test done, but the self-breast examination every month. So that goes to the next, spills over to the next question, which was someone said if they are pregnant, that is they're not having their period, is not daily, still just do a self-breast examination monthly. Once a month is sufficient for your self-breast examination. However, one thing with breastfeeding, like after breastfeeding might change the breasts. So if you do find anything concerning, don't be too alarmed. Still present to a hospital and then have them check it out. It might just be things from the milk things that are producing the milk and stuff. But you can still do a small breast examination once a month, even if you're pregnant. Then the next question was about cervical cancer. That person said when I mentioned sexual intercourse, it wasn't clear if it is transmittable between a man and a woman. So cervical cancer itself is not transmittable. However, the virus that is a major cause of cervical cancer is transmittable. It's a sexually transmitted infection. So that is why we said that people that have become sexually active, that is, they've been having sexual intercourse, they should be going for a pap smear to check to see if the cells of the cervix have been infected with this virus. So it is the virus that causes cervical cancer that can be transmitted, but the cancer itself is not transmitted. And usually the time interval between getting the virus and the person coming out with full-blown cancer can be as much as 30, 40 years. So, because it takes a while for those cells to fully change. That's why we recommend constant pap smears. So every 3 years if you're less than 50, and then every 5 years if you're above 50, just to check that is the virus here. If it has been here, let's remove the cells that have been infected by the virus. And even in fact, a funny thing is, in some countries, the HPV vaccine is given to both girls and boys, so that the boys don't end up infecting the girls they eventually have intercourse with this vaccine. Then there was a question on exercise. I kept talking about exercise. That doesn't mean that if it is not done, it will affect your health. Well, not directly. Just means that if someone doesn't incorporate exercise into their routine, if you're not doing exercise regularly, you're at risk of so many of these diseases. Yeah, at risk of high blood pressure, diabetes, even something like breast cancer. Actually, I know I forgot. Like being overweight is a risk factor for breast cancer. So you have to do exercise to bring down your weight. And even like I say, even if you are slim, it doesn't mean you should not be doing exercise. You have to, in quote, I'm doing apostrophe in my hand. You have to get your heart pumping at least 150 minutes a week. So that's 30 minutes, five days a week. That's like you should strive for that. So it's not that if it's not done, yeah, like directly you get something, but it just puts you at risk. It increases your chance of coming down with this disease. And for people that have been diagnosed with this disease, for them it's even extra important for them to start doing exercise and other lifestyle changes because it also helps with the management of their conditions. And I think those are all the questions that I have written down. I think some people sent some to the chat. Let me check.
Naam, naam. Assalamu alaikum, Dr. Mutmainah.
Wa alaikum salam.
May I read the questions from the chat, ma?
Okay, that's all right. Oh no, I can just open it here and check it.
Okay, ma.
Okay. Okay, there's one here. If a person has breast lumps since teenage years, once started developing breast and still then into adulthood and childbearing age, can it be cancerous? Off the top of my head, I would say there's a chance it's not, probably not. However, the thing is, it might not start out as cancerous, but it could eventually change to being a cancer. So the best thing is to have, or what I would recommend is have the lump looked at. If it's a lump, have it examined. Let them take a few of the cells from the lump and check to see what exactly it is. And just keep an eye on the lump to see if any changes are occurring in it. Is it getting bigger? Is it becoming more painful? Is it bringing out a discharge? Is it changing the skin? But I mean, you should have the lump looked at. Let's know what kind of cells are in the lump. Are they normal cells or are they cancerous cells? And I just keep an eye on the lump. The same way you do it, like the essence of your self-breast examination is to keep an eye on your breast. So just look for any changes because a lump might not start out as cancer and might end up becoming cancer later on. So that's just something to ignore and sweep away. Then, does long management of diabetics have any side effects? And the thing is, there's no drug that doesn't have side effects. Like everything in this world, not even just drug, food, water, everything has side effects. So yes, the drugs that are used in treating diabetes definitely do have side effects. However, before any drug can be used in humans, the benefits outweighs the risks. That's why it's supposed to be used in humans. And if anybody that is on these drugs, like it's not the prescription when you're giving the drugs, it's not a one-off thing that go and use this drug for the rest of your life. I won't see you ever again. The people that are placed on drugs, they have regular checkups. And one of the things they check, apart from seeing how the disease is doing, is also how are you finding these drugs? Are you having any side effects to the drugs? And if the side effects are things that cannot be lived with or cannot be managed with, the drug can be stopped and changed to a different drug. But that decision will be taken by the person that prescribed, or not necessarily the exact person. I mean, like this could be the doctor or the nurse that prescribed that drug will take the decision on, oh, we're changing it to something else, not the patients themselves. I will say, oh, this drug is giving me a headache, I will stop it. If you feel like stopping the drug, go and see your doctor. It's giving me a headache. I'm thinking of stopping this drug. Like, no, we'll change it to this one. It might not give you a headache. So yes, they have side effects, but side effects can be managed. And if they cannot be managed, the drugs can be changed to a different drug. And the thing with diabetes and hypertension, most times in most people, the treatment is lifelong. Like they'll continue on some sort of medication or the other for most people. Then, is having a discharge around the areola part during breastfeeding harmful? I'm not exactly sure about this question. Is the discharge from the nipple itself or from the skin surrounding the nipple? I don't know if I can get a clarification on the question itself. Then, what could be the cause of having frequent periods within a month after childbirth? This particular one, it depends, because the thing with periods within a month is that the normal cycle, and that is the distance between one period to the next, is from 21 days to 35 days. So if, for example, someone has a cycle length of 21 days, they would have more than one period within the month, because a month is 30 days, and that is their own normal. However, if this was not this person's normal before they had the baby, and now they're having, let's say, within more frequent period, just keep an eye on it. If it is less than these 21 days, let's say it is like having your period every 14 days, I don't think that counts as period at that point. It probably is person is having bleeding in between periods. You can go to the hospital have it checked out. There might be other symptoms they want to ask for or do some tests. It's not something I can just answer whether it is what could be particular cause. So it depends on the particular person and other details surrounding this. So if person can go see a doctor and have it looked at. My question is, how often should one be concerned about discharges? Is there anything like healthy discharge? So what discharge, are we talking about discharge from the breast or discharge from the vagina? So please can I have a clarification on that question? Okay, so the skin surrounding the nipple. So the skin surrounding the nipple should not be discharging. It's the nipple that should be discharging. So the discharge from that, I think the person should go to the hospital to have it checked out. And how does one recognize a lump? A lump feels like, I'm going to say it feels like a lump. I don't know, like, if you have a pimple on your face, the way it feels hard and firm sometimes. So you might feel like something like that. It may also feel like, if you take a nylon and then just like small nylon, put a bit of water and tie it, the way it feels, like say soft, I can press it. You can also feel like there's water in it. So anything, it feels like, I don't know, feels like a lump. It feels, or like it could feel like a seed. Maybe like bean, the way beans feels if you touch a bean seed. It could feel like something like that inside the breast. So you just like, it's something different from the rest of the breast tissue. That this thing is not like the other things that are in my breast. It might be a lump. So that's what it feels like. It feels like a lump. Or if you have like an insect bite, when it swells and you press it, something like that. That's also like, it could also feel like something like that. Then my question is that whenever I examine my breast, it is always painful, but there is no lump. It depends on when you're examining your breast. So if you're examining around your period, like the time leading up to your period, even during your ovulation, it is not unusual for the breast to be painful around that time. Just the days leading up to your period, even during your period or around your ovulation time. But if it is that it is always painful or the pain is increasing, you can have it checked out, have it imaged, let them do an ultrasound or a mammogram of the breast and see whether there's anything abnormal in the breast. And okay, discharge from the vagina. Yes, there's something like healthy discharge. The vagina is not made to be dry, and it is so there's healthy discharge, there's normal discharge. Discharge is not always abnormal. I don't know how to explain it. Because there are some glands there that lubricate the vagina. So sometimes you can have white discharge. I think it's when you should be worried is if it is a lot, if it's copious, it's a lot, or it's smelling, or there's blood in the discharge, or it has a different color. If you're seeing like green discharge and things like that, then or its discharge is very watery and things like that. But other than that, if it's just normal discharge, there's something that is normal discharge. So maybe like a bit of white, off-white color, not too much. There's no itching, there's no pain, there's no smell, but there's no abnormal smell. Discharge is healthy. Then, okay, should one be concerned of if the intensity of flow and number of days of menstrual blood flow reduces as one grows older? It depends on the old you are talking about. If the old is like, if the person is around the age of like, let's say like I'm perimenopause, so like 45, I think it's not unexpected that the periods are becoming more irregular and scanty because this is already reaching the retirement of menstruation and things like that. And yeah, around that, as one grows older, like that, around that 45, 50, or they've gone to menopause, what will be concerning is if the period is getting heavier and heavier and heavier. But if it's around that age and it's reducing, it's not unexpected. And which time is the best to have our exercise? And is it normal after eating or before? The thing is, I'm not a exercise person, but from what I think is, I think I have the exercise anytime you want to have the exercise. So people say it's best if you have it just after eating, it helps digestion and stuff. But if whenever you have time to have the exercise. Because if you start putting yourself to rules and so it might make it hard to stick to it. So just have it, enjoy your exercise, enjoy your 30 minutes. Does breastfeeding change one cycle? Yes, during breastfeeding, when you're actively breastfeeding, or even passively breastfeeding, when you're breastfeeding, yes, because the hormones, the way the female system is run on hormones, on a delicate balance of hormones. So during breastfeeding, there's a new hormones are just like in quotes, chemical messengers. They are those that are controlling and or regulating everything that is going on in your body from ovulation to menstruation to even getting pregnant and stuff. So during breastfeeding, there's a new hormone that is introduced into the mix, and that one can affect the way the other hormones work. So yes, it can affect your cycle. Your cycle might be irregular, it might not be like it used to be before. Can trekking to work daily suffice for exercise? It depends on how long you're trekking to work for. So as long as you're meeting the recommended time quota. So for some people, if that's actually an easy way to get in exercise because it's already part of your routine to go to work and just like instead of taking the bus, I'll trek. But if you have time, don't be late to work. It can suffice if the time thing is reached. I think that's everything. Thank you.
Now, Dr. Mutmainah, assalamu alaikum.
Wa alaikum salam wa rahmatullahi wa barakatuh.
Jazakumullah khairan. We really appreciate the lecture, your time, and everything. May Allah reward you abundantly. Now, I won't say I have a question actually, but I want you to please advise young sisters going into medical school. Like maybe you should give us a word of motivation, how you did it. I remember watching your induction and you keep going to the stage for award and award and award. Now kindly motivate sisters or give us a word of advice.
Okay. I was not prepared for that one. Let me see. At the risk of sounding cliche, you read your book, you keep at it. Okay, so let's go. Okay, the thing is, I'm going to be personalizing the advice because what works for one person will not work for another person. So that's the caveat. So for me, I think some of the things that worked for me are number one, knowing yourself. So know what works for you in terms of studying and things like that. Okay, are you kind of person that you need enough time to study? Like you have to like sit down and read everything. Or the kind of person that you learn best when you hear what you want to what you have to study. So for me, I'm the kind of person that I need to hear it. Like when I hear, not that I need to hear, but when I hear it, I understand it better than just if I sit down to read it. I understand I remember it better than if I sit down to read it. So I ensure that I went to as many of my classes as possible. And when I'm in class, I like talking. I talk a lot. But when I'm in class, when the lecturer is in front, I will not talk. No distractions because I know I need to listen to the lecturer because it makes my reading easier later on. So, but for some other people, they need to sit down and read it themselves. So they might decide to skip a few classes to get more time to read. And also, another thing that helped is because I also like listening to it and saying it back. I did a lot of group discussions. So I had a group of friends when it was close to exams or even just normal. We met to discuss, we'll divide the topics that, okay, you read this, you read this, you read this, you read this, and then everybody presents and everybody does things together. So that was because I knew that was the way I study and that's where I learned best. Listening and then also teaching it to somebody else. So if you're that kind of person, that would help. And if you're not that kind of person, find out what works for you and stick to that, regardless of what other people are doing, since you know yourself. That's for the studying part. Then another thing that helps me was past questions. Not necessarily because they might repeat it. It was more of putting myself in the frame of the exam. Like, okay, am I actually studying is my studying making sense? Is it sticking? So when you do a past question, like, oh, I thought I knew this topic. Apparently, I don't know it that well. And then that's that helped me. Then next thing, very, very important, dua. Not just dua and tawakkul. Like just rely on Allah. Trust. Do your best. Put in your best effort. Then rely on Allah. So ask Him for help and trust that it's going to deliver you from the clutches of med school. And have a solid group of friends. Like I cannot overstate it. Have a solid group of friends. It really helps that have similar goals. Because if you don't want to pass and you can't meet them, you not pass. So have a solid group of friends that you can have similar goals and work with them. I don't know. I'm sorry if this was not helpful. I was caught off guard. Let me see what else. So yeah, then study. And nothing that helps again is having a routine. So don't just put all of your reading towards exam time. So a little bit done every day adds up in the long run. So if it's 30 minutes every day, I'm the kind of person that works with time, like because I'm very easily distracted. So if I tell myself that, oh, they're just sitting down for 30 minutes today, it's easier for me to sit down and read. So just do a little bit every day, and then eventually it adds up in the long run. That's all I have for now. I'm sorry.
Jazakumullah khairan, Jazakumullah khairan. Well, inshallah, may Allah reward you abundantly. Sister
I
Amina, Sister Amina, Sister Amina, are you there? So I think we have come to the end of our program. Jazakumullah khairan once again, Dr. Mutmainah. Subhanaka Allahumma wa bihamdik ashhadu an la ilaha illa anta astaghfiruka wa atubu ilayk. Jazakumullah khairan. I look
mean, my
forward to
it was a
meeting you,
pleasure to be here.
Dr. Mutmainah. I look forward to meeting you and hugging you, inshallah.
Inshallah.
Naam. Assalamu alaikum wa
Wa
rahmatullah.
alaikum salam wa rahmatullahi wa barakatuh.
Naam.